tell me who you are and what Rescape Innovations is?
Yes, of course. My name is Glenn Hapgood. I'm the Commercial Director and Co-Founder for Rescape Innovation. Rescape Innovation basically builds technology solutions that remove the complexity for healthcare. Most healthcare professionals are extremely skilled at what they do and are extremely busy. So any new technology that goes in there needs to be simple, straightforward and easy to administer. And that's generally what we do. We take technology that can sometimes seem out of reach for someone who isn't using that technology, artificial intelligence, virtual reality, augmented reality, mixed reality, and we hopefully make the solution as simple as possible so they can at least take advantage of the tech right now.
Brilliant.
Yeah.
Thank you very much. Right. So why VR and why is the strength of this technology?
Okay, so back in 2016 we met with the head of palliative care for Velindre Hospital, who was coming up with a lot of challenges within the healthcare arena around communication. When you tell a patient probably the worst news they're going to hear, their ability to absorb any future information is pretty low. What they're thinking about is their spouse, their partner, how am I going to tell these people, what am I going to do with my children, am I going to be able to work, what about money coming in, all those concerns and all those stresses. Yeah. So when the head of palliative care was trying to tell them your chemotherapy is here, your MRI scan will be here, what they were finding was that people weren't really taking that information in. So they had a lot of people not turning up for their MRI scans. People weren't really understanding what it was, so they were getting anxious and stressed about what an MRI scanner is. So they weren't turning up for the appointments. So you ended up with a lot of missed appointments, so therefore a lot of cost implication to that. So we created a VR MRI experience for Velindre Hospital that they were able to show patients when they're in that frame of mind to be able to put it on their head, allow them to go away, experience the MRI scanner, lie down on it, be talked through it by the radiologist in the VR experience. And what we noticed was that every time that one of the patients wore one of these, they were visibly became less agitated, less stressed. You could see their chest heaving a lot more smoothly. And they looked visibly, their anxiety and stress was dissipating and you could see it going. So we really wanted to investigate further why this was happening. There was the distraction therapy element of it. So we looked very much at America and the US, who are very far ahead of the UK at the moment with VR technology, although we're catching up now. And the amount of trials, there's over 600 trials done worldwide now with VR in healthcare. And the results around distraction therapy alone are huge in reduction of pain and anxiety. But then, of course, there's the element of training and education. What VR does for clinical training, you get told the old adage, I think you learn about 10 to 20% of what you need to learn in the classroom. The other 80 to 90% you learn vocationally. Well, VR bridges that gap and makes classroom training vocational training because they're living and breathing it. So, everything from surgical training themselves all the way down to actually induction training where they need to learn the fire safety procedure. So lots of opportunities with VR, lots of avenues for it, and lots of benefit.
Oh yeah, definitely. Oh goodness, how is VR more powerful than other ways to patients, to how patients interact with technology?
Sure. Well, VR, I think the big thing with VR is very much the same reason why it's so effective with marketing and messaging and all those sort of areas is you have a closed audience. So I have a 21-year-old son, and I love him to bits. Trying to communicate with him is like pulling teeth.
I understand.
Yes, I've got to turn off his computer. I've got to take his phone out of his hand, shut down his Facebook, his Snapchat, his Instagram. I've got to turn the telly off because he's got Netflix on. The stereo is blasting. I've got to turn that off just to be able to get some words with him. Now the good thing about VR is that it actually is all encompassing. So there is no what we call noise. Deterring from the messaging, deterring from the treatment that they're having, interrupting it. So in comparison to, well, if you look at what healthcare currently has, which is usually a photocopied black and white folded up piece of pamphlet, it's obviously leaps and bounds ahead of that. But it's the encompassing element and the fact that people feel like they're there, are signed into it. It increases the empathy of people that they're watching it. So it's all those things that add together that make it such a viable and successful solution for these sort of areas.
I can understand that. Who in healthcare could benefit from VR and how?
Oof, gosh, okay, how long have you got? Okay, so patients, obviously, you know, even something as simple as, you know, taking away the medical benefits, take away how it can increase, reduce the rehabilitation time, take all those medical things away. If you look at the patient experience, there is not a person in the country, I don't think, who enjoys a stay in hospital. You don't.
No.
You know, and that's not the hospital's fault. The nursing staff and the doctors do every time I've had to stay in hospital, my family has, you know, it's always been made as comfortable as it possibly can by the great staff that they have there. But it's still staying in hospital. You're still not at home. You're still not with your loved ones enough because there's visiting times. You're still, you know, in bed with someone opposite you who's moaning all night, so your sleep is affected. You know, it's all those little things. So even with just looking at the patient experience, of being allowed to give someone 10 minutes away from that environment. You know, instead of being in the hospital environment like this, you actually get transported to the moon, or Brazil, or Bali, the Great Wall of China, wherever it is. It's allowing you to have that break from the stress and anxiety which is caused by your surroundings. So even that, just the patient experience alone, you know, if you think about people with you know, locked-in syndrome, you think about people who have just gone through an operation and have very reduced mobility. You know, giving them the opportunity to be able to go somewhere else, do something else, be somewhere else, or even be someone else. It is that element of fantasy that I think 20 years ago we've only dreamed of, really. We could only get from a TV or a film and your own imagination. Yeah, it's brilliant.
Around you, it's full 360. So above you, behind.
That's pretty cool.
So this is a underwater experience. So these are all designed to take a patient away, allow them to forget their stress, their anxiety, and even to forget certain levels of pain. Because within virtual reality, you are forced to see only what we want you to see. There is no peripheral vision. Your brain only focuses on what's in front of you, what it can see. And by wearing headphones and concentrating on the soundtrack, the commentary that we've created, we enhance the effect. And this means that you can only think about what's in front of you, focus on what's in front of you, and your stress and anxiety can fade to the back of your mind. Now it sounds simple, but into of the power of VR, this effect can last an hour and more, and then you can go back in and try another experience, or even try the same experience again.
Is there it's like a tiny little window, and if you move your head, you lose the picture. Is that?
Yeah, it's because, so the trouble about AR, the reason why I like virtual reality more than augmented reality, virtual reality has a letterbox view. Because you're looking at two screens in front of you, and they're creating that 3D image, you've only got a letterbox view. So wherever you look, that's all you've got.
Right.
If you have VR, of course, it's screens that are all encompassing, so it's everywhere. So that's the difference behind it. Soon, these glasses will get closer and closer to your eye, so that the field of vision isn't a letterbox, but it becomes bigger and bigger and bigger, so it ends up being the whole of your face almost. They're looking at things like contact lenses to be done, and things like that. So. Yes.
That's really weird. It's cool though.
But again, because you can walk all the way around the table, and you can see what you're doing, and if I had one of those as well, we could both talk about the solar system in front.
Wow, it's amazing. You've got the sun in the middle and then you've got all the...
planets walking around. It stays where it is.
Yeah, it stays in front of... Can you do that?
Bit more of a... oh, there you go.
It's very loud. I can see what you mean by the sort of...
Yeah, it's just like a letterbox,
Especially if you get close to it. So if you walk a little bit closer to it, you can only see a portion of it, and that's what disappoints me about AR at the moment. But that will change as technology gets better and better.
So what can you see, Chelsea?
I can just see the sun, and I can hear it, like if it's like giving off little gas bubbles and explosions. I think that's better